of mind. So although these days we often hear the term mental health very commonly, especially on social media, and a lot of celebrities coming up and talking about depression these days. So I feel people are a little more aware than before about mental health, but still not completely aware. So as 3 years back when I took psychiatry, so the response was quite welcoming. किसी ने ऐसा नहीं बोला कि psychiatry क्यों लिया है. So everybody had appreciated my parents that you have done a good job because people are getting more aware. But अगर कुछ साल पहले की उससे पहले की बात करें तो people they didn't give quite a good reaction. मैंने कुछ और लेके तो psychiatry क्यों लिया है. So the scenario is changing. So I'm very glad. But still, when I say stigma is still there, by that I mean for those who have symptoms and those people who know that they need help, they still don't seek help. I don't understand why. So they still don't seek help. I've seen so many cases in my near and dear, my relatives, in my MD postings, that they are suffering so much. They will show to any other doctor but not a psychiatrist. So the stigma comes here. But stigma is very understandable because हम लोग ने जो mental word है उसको mad and crazy के साथ associate किया है. ये पागल है, ये पागलों का doctor है. So obviously when somebody is suffering, even if somebody is suffering so much, they hesitate to go to a psychiatrist. They will show to a neurologist, they will show to any other doctor again. But you might relate this with yourself, even if your loved one or you have had problem any time of your life. But how many times have you actually gone to a psychiatrist? So stigma comes here. So, but I would like to ask you that if at your home somebody has a BP of 200 or has gone 250 or has a very high grade fever, nausea, vomiting, and if I tell you that just wait, don't show it to a doctor, how would you feel? Obviously with those symptoms you would rush to a doctor. Then I don't understand why with those mental symptoms people are still suffering and sitting at home and not showing it to a doctor. So here comes the stigma. So people are improving, they talk a lot about mental health, but still hesitate to show it to a psychiatrist. So I'd like to share a few examples, like a few disorders, like very common disorders, like person with, suppose a person has chronic irritability, बहुत झगड़ा कर रहा है, is verbally abusing, physically abusing, घर से बाहर निकल गया है और is suspicious, बहुत शक की नजरों से देख रहा है सब में. So these symptoms could suggest some personality disorder or it could suggest schizophrenia. So depression is not the only psychiatric disorder that we know, right? So similarly, a person with depression, what are the symptoms? A person who was very cheerful at one time of his life, but now is not able to feel pleasure. We have read questions in this questionnaire also, but these are very brief. So अंदर से खुशी नहीं होती है अभी, पहले होती थी, but अभी नहीं होती है. किसी से बात करने को नहीं मन करता है. Suppose if a person with depression would struggle to come in this setting and talk to people and communicate to people. Even if people are calling that person, you would get irritated. और अंदर से बहुत effort लगेगा. And that thing was not happening with that person before that. So these symptoms could be a sign of clinical depression. Now again I would like to say that normal sadness and depression. We use the word depression very casually, like देखो depressed लग रहा है. तो but ऐसा नहीं है. We have all been sad at one point of our life. Everybody feels sad. आज किसी ने कुछ बोल दिया तो I could have gotten sad. So but depression is a clinical disorder. Whereas sadness it comes and goes. Depression doesn't come in one day and goes another day. So it's a disorder that needs attention. So if I talk about anxiety disorders that are also very common in women and men, anxiety disorder में a person is constantly worrying about very very small issues. क्या होगा, बच्चे कैसे स्कूल जाएंगे, इनका क्या होगा, फ्यूचर क्या होगा. So always on the go. So mind is not able to rest so much that sweating होती है, tremors होते हैं, that you can also get a panic attack, right? So person has come to you, often people share that suicidal thoughts, the thoughts of harming self. If a person is sharing, we often think it's a myth that people think कि उससे बात करने से वो aggravate हो जाएगा, और if ये मेरे से बात कर रहा है तो करेगा थोड़ी attempt थोड़ी करेगा, but it is not true. If a person is sharing the thoughts of self-harm, he might attempt. There is a very high tendency that he might attempt. It's not just that he is talking. And suicidal thoughts it's not normal. That somebody wants to harm himself or herself. Somebody wants to take his life and wishes to die. So these are not normal thoughts. And suicide is a medical emergency. So if somebody talks to you regarding these thoughts, then our duty is to take it very seriously, and because that needs urgent attention. It is a medical emergency. One thing. So also, if I talk about OCD, a lot of women present here, we like to keep things clean. घर एकदम साफ होना चाहिए. Even if the maid is working, we like to supervise on top of it that सब अच्छे से है या नहीं. Somebody enters with dirty shoes, नहीं बाहर निकाल. So these about cleanliness thoughts. So it can be a normal personality. But what happens in OCD, if the same behavior becomes very excessive. If you see a person washing hands again and again, if you see a person washing clothes or having these thoughts again and again, it could be a sign of OCD, right? So you never know when it exaggerates. So OCD is a clinical disorder and is not normal. So what is difference between normal and OCD is that these thoughts will distress the person. Even if the person doesn't want to wash hands, you are in a compulsion to wash. So this is a disorder, and it is very stressful for the patients who are suffering. So I have listed just a few symptoms of some very common disorders that if you think you can relate to yourself or in some other family member, then it needs attention. So, like for example, depression and anxiety disorders are so common, the most common cause of disability. So, and we think sitting at home that these disorders are not treatable, but these disorders are treatable. So, for example, depression, if you seek proper treatment, is treatable with antidepressants and therapy. So, mild level of depression can be suggested that yoga kijiye. But if someone has moderate to severe level of depression, if someone is not able to is not having that energy to exercise, not able to wake up from the bed, how can he do yoga or exercise, right? So at that point of time, that person needs antidepressants. So you can't suggest him do exercise, go for a walk, because that's a disorder, right? So, but with antidepressants. So another myth is that people who reach to a doctor take medicines also, but they have this question that will I get dependent? Antidepressants will cause dependency. So a lot of people ask that they have a dependent हो जाऊंगा, so I won't take psychiatric drugs. These are very dangerous. No, antidepressants are they do not cause dependency. The only drugs that cause dependency are benzodiazepines. If you might have heard the name Eltrax or Alprazolam, clonazepam. So, but if you go to a good psychiatrist, a psychiatrist will never prescribe you these drugs for more than a few weeks. So then they taper off. But antidepressants, which are the mainstay of drugs for depression or for anxiety, they have to be continued for longer term, that is 6 to 9 months, which most people don't adhere. So antidepressants, one thing, they do not cause dependency. So the next question, people think why some people have mental disorders, why some do not. So since there are a lot of various factors, biological factors, psychological factors, social factors, so there can be vulnerability at each of these levels. So since we are all women here, social issues like suppose at the time of marriage, for a woman to adjust to a completely unfamiliar setting from a completely familiar one, it requires a huge amount of adjustment. In Indian context, we are just required to adapt, but for a vulnerable woman, it could be a huge adjustment and could, in that period, she's prone for a psychiatric disorder as well. For other life experiences, for example, abuse, both psychological and sexual abuse. So, and majorly for women, vulnerability at hormonal level. So, first of all, at puberty, then before and around menses, you might have heard the term PMS, premenstrual syndrome, where we get mood swings, irritable, and some physical symptoms, breast tenderness, all these symptoms. These are very mild, but if these are very excessive and stressful to you, there is a disorder named as PMD, premenstrual dysphoric disorder, which needs attention. So, around menses, then immediately for a woman after giving birth, that period is called postpartum. So, postpartum disorders are very common. For example, postpartum depression as well as psychosis. So, in psychosis, the mother doesn't want to touch the baby. He has thoughts of harming the baby. And at that time, the person is not aware what is this. So, might harm the baby as well. Because in that condition, you have to separate the mother and the child and stop breastfeeding. So, postpartum psychosis is also an entity as well as postpartum depression. So, then around menopause, perimenopausal depression. So, all this is either due to fluctuations in estrogen and progesterone levels. So, especially around these phases,